You look, but can you see? Here we stand before you, each and every day. A struggle so immense, yet you pass us anyway. With dreams of living life as it was meant to be. Success, stability, health. We want the same things. Can't you see? We are reaching for your hands as brothers and sisters of this earth. Here we are. Here we stand. Do you see us? The statistics are staggering. Throughout our country, men, women, and children suffer, particularly those who are living in poverty. Health disparities are differences in the incidence, prevalence, mortality, and burden of disease that exists among specific population groups in the United States. The U.S. Department of Agriculture estimates that about 23.5 million Americans live in food deserts, including 6.5 million children. These disparities mean higher prevalence of disease and shorter lifespans. Our health is impacted by many things, including genetics, environment, diet, lifestyle, access to resources, income, and education.
Say about my students, especially in this neighborhood, is that they don't have a lot of access to stores that sell healthy produce, vegetables, fresh meats. They eat microwavable meals, or they eat bags and bags of unhealthy chips, or they drink sugary juices.
We do have an initiative here at our school where the kids are provided with different fruits and vegetables every day, trying to expose them to those important health choices.
So how would you feel if this corner store became a healthy corner store?
I like that idea. I love it because I have children and they like fruits and vegetables, and it'll be a better distance for me walking all the way down to Bankhead to get fruits and vegetables, but I can just get it from my house.
Right? So do you cook fresh vegetables?
Yes, I do.
Okay, that's good. So this will be easier for you and very convenient.
Yes.
And you like the idea.
Yes.
Do you think all the other residents in this community would have?
They would.
Okay.
They would.
Sounds great. Let's make it happen then.
Let's make it happen.
Great. Good job.
It can be difficult to be healthy just because there aren't a lot of healthy eating alternatives, even though they really do try, I think. But as far as combining convenience and health, I have to opt for convenience more than I want.
I have a grandmother who has fallen ill. Now this grandmother, she's been diabetic for about 20 years. And just recently her kidneys have begun to fail, and she's now on dialysis. And I think one of the biggest issues is, as a family that's originally from New York, when she relocated to the state she's in now, her insurance benefits don't work like they would in New York. And so she has different access issues, like access to a mobile van that will take her from her home to the dialysis center, or insurance set up where she wouldn't have to pay a co-payment. And so I think with the full implementation of the Affordable Care Act, that she would benefit from the new provision, so that her insurance would carry her across the country, so that she wouldn't face those types of issues.
In the elderly patients, there are a lot of illnesses. There could be diabetes, osteoporosis, cancer. What do I do? Where do I go for treatment? I need to have proper treatment, because after all, a patient of my age may be having 5 or 6 different conditions.
Environmental justice is really about making sure that all people have access to a safe and healthy environment where they live, where they work, learn, where they play, and where they worship. Factors outside of a person's own control can affect their health, such as pollution, air pollution, water pollution, runoff, soil contamination. These can all cause terrible health problems like cancer, asthma. Pretty much all religious traditions have 2 really integral values of caring for the earth and caring for each other.
South Asian culture is family-oriented, so families use food and dinners to get together. And the diet is heavily based on spices and salts, which isn't really the healthiest thing to eat. So that's not good for chronic diseases, especially like diabetes and high blood pressure and cholesterol. I think culture really has an impact on health.
And also Indian families, we eat a lot of mainly sugar and starch and, a lot of proteins and stuff like that.
Cardiovascular disease, cancer, diabetes, HIV and AIDS, asthma, and mental health are just a few of the many critical issues that we face today.